Could you kind of sum up what today's meeting was about, why it was important?
Well, certainly it's the county commissioners are really working to fully understand the deflection program, make sure that we can find ways to improve it and move it in the right direction. I think we've heard extensively from the community that they want to see better outcomes.
So, we heard your presentation of changes that need to be made. Was that sort of what the focus today was with your presentation here, or were there other things that came up that were also?
The focus of my presentation was just to make sure that everyone's clear on the district attorney's role in deflection. And that role, put simply, is that I get to decide when criminal charges should be filed and when they shouldn't. And so I've made that clear to the various members so that moving forward, we can understand that if people don't engage in deflection, or if they simply walk away, or they are not following through with their treatment obligations, that this office is going to move forward with prosecutions. And yes, we will do everything we can to help them get back into treatment, but we need a program that this community can have a reasonable expectation is going to work, that's going to help get people into treatment.
I know that the commissioners are meeting about this right now, but at the end of the day, the executive team that created the program to begin with would be the one that would need to make those changes. Have you heard from the executive team on whether or not they're open to that?
Well, I want to be clear. The executive team does have the opportunity to do things like put together a pathway center to provide a lot of support for individuals going through it. But when it comes to those decisions about is someone going to be prosecuted or not, that's the district attorney's office's role. And so we certainly will coordinate and work with the executive team, but I want to just always reiterate that the district attorney's office maintains that responsibility, and we will continue to do that.
So I'm curious about some of the technicalities on that. Essentially, you're going to get a list from police officers in the county on who they bring to the deflection center. If the county's hired contracted providers do not provide you information on whether or not that person is engaged, you will assume that they have not engaged. Is that accurate?
That's correct. And then it ultimately comes up to that individual, and it's their responsibility to show that they have engaged in treatment in a meaningful way. If they come to us and they can show us, whether it's through the county's pathway system, whether they've used their own insurance or privately went out and engaged in treatment services through any number of different pathways that they could find treatment, certainly we will look at that, and if they've meaningfully engaged in treatment, then their case will be dismissed. But if they haven't, and there's no one either coming forward from the county deflection center or coming forward as an individual to say, I have done these things, then we'll be filing charges.
Do you have enough resources for that? I know you're talked recently about how your department is under budgeted, et cetera. You don't have enough money for a lot of programs. How will you fund this?
So this is a critical area for our county and our community. We will be using internal resources to make sure these cases are prosecuted. Just this weekend, I was in with my attorneys. They were working hard to making sure that these cases, throughout the spectrum of what we do, that we are there taking care of this county, taking care of the public safety needs of this community.
How do you think the judicial will approach this if you're divided with the county on how you handle things?
Well, this is one where I do think that our current defense attorney providers from the major provider nonprofit firms, I'm going to have to find a separate way. Unfortunately, they have not been collaborative. They have not been working with us. And so we're going to work with the state of Oregon, and we're going to find a defense attorney who does want to step forward and work with the DA's office to help this community. This is one where I see a lot of opportunity, but we're going to need to find some individuals who want to collaborate. In my discussions with the judge and the courts, they're ready to step in as well.
And in terms of whether or not you've heard from the chair and the executive team on this, have you guys been in conversations at all? Is she willing to talk with you?
Oh yes, we explained this new process and put forward to them several months, or at least a month ago, and we've been in discussions with them. And it's this is one where, quite frankly, we're not asking for permission. This is just what we're doing.
So what has her response been?
I think a lot of the response and discussion is, like I said today, we can certainly talk about what success looks like and have them weigh in on that and give us their input. We can certainly discuss, what types of services that they're going to be able to provide through the Deflection Center. And so we're having a lot of conversations around that topic.
Are you willing to be flexible and reach a compromise if they do say, yes, we're okay making changes, let's make the changes together? Are you willing to work with them on what those changes look like and bend on some of the requirements that you've stated?
When we say flexible, am I flexible on the decision about whether we're going to start prosecuting people or not? No, I'm not. That's going to happen. We're going to move forward. That decision has been made. Where I am flexible is in defining success on how we can help people get to treatment. Absolutely. I want their input. I want to work in a collaborative manner to get as many people to treatment as we can and to really help them. And what the community needs to remember is that this is just deflection is the first step. There are additional and second steps that come after deflection, where again, we're going to be diverting people away from jail and trying to get them in treatment. So if someone is unsuccessful at deflection, we're still going to give them lots of other opportunities, and we're going to work with them and do everything we can to get them into treatment.
Last question. I know you're giving me the look. I get it. I have side eyes. So with the chairs, you mentioned you're in talks with her. What do those talks look like? Are you meeting in person? Are you sending emails, phone calls? What does that look like?
We provide them with a detailed memo. I know that I have my general counsel go to the leadership meetings and explain to them in depth kind of our position and how we're moving forward. And so those conversations are ongoing.
Phone calls, emails, or with the chair specifically? Because I know you mentioned that.
I have sat down and met with the chair, whether or not we've talked about a whole host and range of topics. So.
All right. Thank you so much. Thanks, Pat. Appreciate it. Great. Can you say it spell first and last and then title?
Yes. My name's Shannon Singleton, S-H-A-N-N-O-N, last name S-I-N-G-L-E-T-O-N, and I am the Commissioner for Multnomah County in District 2.
So the last time we talked, not directly, but through your communications person about Vasquez's proposal, you didn't have a comment on it. In hearing some of the various directions today, do you have more of an idea of what you think about his proposal at this point?
I think, with his proposal, I think it's really critical that we set up the systems that I've put out there as far as the needed reforms and make sure that people have a pathway. I think we've not set people up for success. And so in order to get to that next step of having accountability, I'd like us to see us really reform that part of the system that I think is still not functioning for folks. To me, this is a both and. It's just about sequencing how we get there. Because another component of what I hear from DA Vasquez is that it's also opportunity to open up additional charges that could be eligible. But again, the first step is the reforms that I've proposed around getting people into clean and sober shelter, actually getting them assessed more quickly for treatment services, and making that service connection as opposed to doing a referral-based system.
And he's going to move forward with charges regardless of what happens here. Are you pushing for a more collaborative effort so that once those charges start taking effect, maybe some of the things that you guys are hoping to change are also happening?
Absolutely. I'm pushing hard for those reforms that I think we need now, and I'll continue to do that and have conversations with the chair, with our departments, as well as with our service providers to help get things in place for that. Some of it I've mentioned is low-hanging fruit. I think even just at a minimum getting people on the by-name list so that we know that they're a part of the homeless services system, getting them assessed for homeless services as far as the coordinated access assessments, that to me is low-hanging fruit components that we just need to do. It might take a little bit longer for those next steps. I think my perspective with the DA is that we continue to have conversations and make sure that we're on the same page, that we understand what each other are doing. And I think that for me, he showed up in partnership to say, this is what I'd like to see as next steps. These are going to be my next steps, but I also support the reforms that the commissioners like myself have proposed.
And in terms of the accountability measures, Multnomah County's deflection program, when compared to the rest of the state, is the most lenient. You guys don't hold charges in abeyance. You let people walk away. When police drop them off, they can make up their own mind whether or not they want to stay. Are there changes in some of those aspects that you want to see?
I think yes, there's some conversations I want to have. I think there was a mention by law enforcement of the person just walking away. And one of the questions I had is what does happen for them? Are we seeing them in rearrest data? Excuse me, are we seeing them in the rearrest data that the DA mentioned? Or is that person, where are they going from there? I don't think we've been tracking them. And so that's a question I have that I'll do some follow-up on. I also think it's the question of expanding types of charges, that needs to continue to be a part of that conversation, and understanding what might look different, whether it's a PCS charge or other charges being a part of that, to ensure that we know that people are either going through the system appropriately or they're not. Something I did ask that I think is a follow-up for us to do is, what are the outcomes for people who do go through the court system? I think it's important that we don't pretend that we see good treatment outcomes for folks necessarily who go through jail. I'm not saying some people don't get access to treatment and make that decision and move forward on that path, but we haven't actually looked at any of that data, and so that's some of, I think, our next steps, so that we as a commission understand what financial resources we're also putting to the criminal legal system, what the outcomes are there, and deflection, and what are the opportunities and outcomes there. So we have to really be looking at both.
So you're saying, essentially, if we're putting all this money towards deflection and we're getting at least this many results, but we're saying we should do this instead, does that yield the same
better,
or
different,
gotcha,
results.
Understood.
Yep.
And then with the just being able to walk away portion, would you be in favor of saying you failed deflection if you just walk away?
I do think that you fail deflection if you walk away. I think there's a lot of other questions I would want to add. As a clinical social worker, there's a lot of other questions I would want to ask that person. I think there's still opportunity to connect them with homeless services, even if they might follow through with a PCS charge. They shouldn't just walk out the door and have no connection to the county. And so to me, it would be, maybe it's not the deflection center staff that is their engagement, but are the outreach staff that we have in the community connecting with that person? Are we able to bring them into the homeless services system and still provide those needed supports that they need to move on in their path of recovery, even if it's recovery from homelessness and they're not quite ready to step into recovery from addiction? Let's at least start them on one of those paths that the county holds the keys to.
So you're talking about data and favorable data and looking at that. I know you guys looked at Jackson County. Unfortunately, I wasn't here for that portion, but I did look at their program. I know that they require at least three calls with a treatment provider, 3 engagements with a treatment provider, and they have success rates with that, with the people actually following through with that. They also have a large number of arrests when compared to other counties for drugs. So it would seem that their accountability measures are working. Would you be in favor of adopting some of those more restrictive accountability measures?
I think that the number of calls that they're making, that's more about defining what engagement means. I've heard the DA had a memo that says that they've engaged in services within 90 days. I think that's for us to define. I think that Jackson County has one definition of what that engagement looks like. I think we heard from our public defenders today that they have a broad range of it's engaging in case management. It might be accessing shelter. We've heard from some programs that it's 10 progressive engagements. There's a lot for us to decide what that looks like. So I don't think it's about adopting necessarily what one entity is doing, but us defining what do we think engagement means in Multnomah County. We know that we don't have ready access to treatment. And so saying that somebody has to access even assessment within 30 days might not be realistic with the wait times. So I think we have to actually define what it looks like, knowing what we have the opportunity for people to do. It doesn't mean that on the back end there isn't that support. That's why I'm pushing so hard around the clean and sober shelter, knowing that there's not treatment space for everybody. At a minimum, we could put them in a supportive environment where they aren't sleeping outside. They are around other people who are trying and want to be clean and sober, and we can put them back on that path. It's much easier to go to appointments when you have a place to sleep than it is to try and navigate it when you don't. I think towards the end I said right now we ask people to navigate homeless services and behavioral health systems at the same time. I want to remind us that 92% of participants in the first year are experiencing homelessness. And so the fact that right now there's no service connection to ending homelessness work is unconscionable. And that to me is our first step.
So, I mean, they do make referrals to shelter. Are you just saying it's not happening enough and it's not as warm handoff?
The warm handoff, absolutely. Making a referral is very different than saying you have a bed tonight and I'm going to bring you to that bed. And I want us to go to that second part. I don't want to just refer into shelter. And so it does require us to talk with our homeless services providers, our shelter providers, and say, what resources might you need to be able to accept referrals this way and actually have beds set aside for somebody to come into? We do shelter bed set-asides now for a lot of different things, including some of the work the city does around camps. We can do it for other things as well, and that's the conversation that we need to have as a county with our providers.
In terms of the feedback you got from the provider on how difficult that would be, how feasible that would be, what did they say today?
We didn't have providers today talk about accepting folks into shelter. We had providers talking about how much more success they have when they take somebody to that treatment bed, that assessment, or to that shelter bed.
Oh, I guess I meant, to be specific, Turk House. Would they be willing to make that warm handoff? Did you hear from them on that?
We did not hear from them on that.
They weren't here today.
They, I believe there was somebody online,
Okay.
but they didn't speak today.
Okay.
So
Do you know why?
It was really for us, we told everybody these questions, and it was kind of on commissioners on who they wanted to call up. There were no specific questions for Turk House.
Gotcha.
I think likely because we've heard from them in other deflection work
Understood.
sessions.
Okay.
But for that warm handoff, whether that's Turk House, whether that's existing outreach staff that we have, whether that's new peer staff that we want to add, whether it's existing peer staff connected. I'm agnostic on the who does it, but we've heard reception from everybody that we want to be able to do this. We just have to talk about and resource it to do it. So that's really the question for me, is what will it take to get it done? And then how do we put the resource behind it so we can see better success for the people trying to access deflection and sobering?
So there is kind of a ticking clock here. I mean, the people that police are dropping off at deflection don't know that they could face charges if they're not engaging. Are we trying to tell them? Are we changing protocols ahead of this very quickly approaching deadline where Vasquez will start pressing charges?
I think it's important that we share some messaging with, again, our outreach workers, the first responders, and our partners at the city so that they're educating people about this shift. I also think it's important that to me, the timeline is for us to put in place the supports that people need. I think part of our challenge where you hear DA Vasquez saying there isn't success as far as that person actually accessing treatment, part of that is because we have not set them up to be able to do so. So the ticking time clock for me is us to get those services in place so that more people can be successful. And frankly, when the story of success starts to become a conversation in the community, more people are willing to try it. So I think that's the piece that will really shift for us. But in the meantime, I think it's critical that we at least share some messaging like we would with anything with our outreach providers so that they're able to share that with folks on the street.
And just from a technical standpoint, when does that happen? You know, because the chair wasn't here, obviously changes to the program. I don't know how many. I think if you were going to change significantly, you would need to pass it through the chair, but I don't know, are providers just going to be instructed here real soon to start telling people, hey, you might face charges? What does that look like? How will the public find out about this?
Yeah, so it's we do it all the time, just like with the city of Portland when they've had changes in how they're going to enforce the camping ordinance. We generally get messaging from the people who are in charge of that, and we share it with outreach providers and staff across our homeless services system so that they can just be informing people based on what the messaging is from that entity. So in this case, I would do some follow-up with the DA just to say, are there particular messages that you think are important to share about this? And then ask the Homeless Services Department if they're able to share that with all of the providers. So it's really kind of a common practice. This is just a different program that would be kind of wedging into that common practice.
You haven't mentioned Turk House. I mean, Turk House is the one that would be talking to these people who would potentially face charges. Are they going to be instructed to say, hey, if you leave here today, you're probably going to face charges?
You know, that's a great question. I'm not sure. I think that that's probably critical for them to know so that they can incorporate that into their conversations with folks. I'm thinking more pre-education and kind of how we do that so that folks know coming up. But that's a great point that Turk House should also have the correct messaging to share with people so they know what their choices are and they're able to make them thoughtfully.
Do you get to tell them to do that? Who tells them to do that?
Yeah, unfortunately, I don't get to direct the department or the provider, but I absolutely will do follow-up and strongly suggest as well as ask for that to happen to make sure that people are aware of these changes so that they know how to navigate the system and, again, make informed decisions for themselves.
And then when do you expect actual conversations with the executive about changes to the program? Because now, I mean, you've had these work sessions. Are there going to be more of these and then the executive? We haven't heard from the chair, for example. Yeah,
so I think the plan is, well, I'd like it to be one more work session. I know there's a lot of content. I think this could go on and on. I think we have to shift to let's make some decisions about what we're recommending as a body. Some of the decision making will come up in our budgeting process. It may not be that we have funds right now to do all the things that we want to do, but we have to think about about how we want to invest in the 27 budget. Some of that, like the low-hanging fruit I've mentioned, it's going to continue to ask, and my conversation with the chair will be, I've been asking this, how are we implementing it, and can we get this done? And I think there's some others that I've heard from other commissioners in that same vein. And then we need to shift to an implementation place where then we're hearing back from, is it quarterly, is it bi-monthly? That's some decision making we still have to do. But at least one more work session to get some more answers on the action items I mentioned at the end of the work session today, so that we can get to that place. I think critically it's defining success. If we want to redefine success, we actually have to give concrete recommendations on what we want that to be and agree as a board, and we haven't done that yet.
And that would need to go through the CJC if you're redefining success, right?
It wouldn't have to be redefining for what the CJC wants. This would be on top of, right? We can still success right now is deflection from the criminal justice system. That can still exist, but the Multnomah County wants to add on to that success for the individual, for the human being. And so that's the piece that I think would look different.
But in terms of saying deflection has been successful, deflection, you failed deflection if you walk away from the assessment, you've automatically failed. Those types of changes would need to go through CJC and would need to be approved by the executive. Are you asking for that to happen?
Those types of changes are a part of what the accountability structure of deflection would look like. So I think that those, I'm not sure that they have to get approved through the CJC. A lot of other entities are already doing that. But success as defined in the statute is about deflection from the criminal justice system. So if somebody ends up in the criminal justice system, then they haven't successfully completed deflection. So that's inherent in that definition.
Gotcha.
Yeah.
Okay. Well, thank you so much for your time. Anything you want to add?
No, thank you so much. I'm so glad you all were able to be here today. And I think just want to again uplift that we have the data that we needed from the 1 year, and now it's time to make some reforms and adjustments to what we know we need to shift to really set people up for success in their path and their journey in recovery.
All right. Thank you so much. Appreciate
Thank you.
it. Can you just say and spell first and last and then your title?
Yeah. My name is Vince Jones-Dixon, or Commissioner Vince Jones-Dixon, VINCE-JONES-DIXO.
And then I'm just trying to gauge where you're at with the deflection program, with the changes that Vasquez is not only proposing, but also saying, I'm going to go forward no matter what.
Yeah, we're currently, East Multnomah County is a little different than the rest of the regions, specifically just how we coordinate and engage our neighbors that need help and or services. So I really appreciated the comments that were made by both Grant and Tony as far as like assertive outreach and figuring out how do we do that in a way that's healthy and actually moving folks along on their pathway of recovery. Specifically to DA Vasquez, we're still in a posture of learning. So we just reviewed his proposal last week, and we're looking forward to continuing to engage in those conversations and exploring the options. I think it's key that we have Judge Odin or a part of the conversation, or specifically the courts, to really think through what that would look like in the future.
So at the end of the day, the executive team gets to decide whether or not to change the deflection program. What are your conversations with the chair looking like on this right now?
Yeah, we've been discussing a lot, again, just what does that look like in District 4 specifically, because the Deflection Center is in inner Southeast Portland or East Portland specifically. So just thinking, we've been presenting just pilot programs, like the work that we're doing for the recovery, and just how do we roll out that work and those services in East Multnomah County. And ultimately, the majority of the board has the decision as far as the direction that we want to go as it pertains to the policy and how those services are being rendered here within the region as well.
Is the chair open to changing the deflection program?
The chair is extremely collaborative, so we look forward to, again, all of us working together to figure out the path forward for deflection and the rest of the services here in the region.
So, I mean, at this point, with the district attorney saying, I'm going to move forward with charges no matter what, do you think it would be wiser to say, hey, let's work on this together and let's figure out a way to make it more comparable to what we want? And is that going to happen? Why hasn't it happened yet?
Yeah, that's a really good question. To the DA Vasquez's point earlier this morning, he has the sole responsibility as far as the public safety authority to present options, and then he's still coming to the table, and he said he's open to working with everyone as far as developing a system that works. And then he's really looking at the public safety system and looking at the tools that they can use in order to encourage folks on the pathway to recovery. One of the things that he mentioned, or one of the things that's in the report, is just how those the charges that he's recommending are expungible based off of your engagement in the process. So again, we're looking at it collectively as a board and as a team, and I'm looking forward to what we develop over the next couple months.
With the charges coming as early as January, when do you expect to actually have those, difficult discussions with Vasquez and decide how changes would take place if they are going to?
We didn't talk about that today, so that's a question that I'll have to follow up with him and the rest of my colleagues.
On
that's
when
a good,
it would happen?
Yeah, that's a good question. That's
And
a good
then
point.
you also heard from PPB today,
Yeah.
and they are complaining that, this drop-off system where somebody can just pick up and walk away is not working. What do
Yeah.
you think about that?
I think they're right. Assertive engagement, and also we need to look at what's working or what the services or how we're engaging with folks when they're in our care at the Pathway Center. So again, it's an area. One of my mentors always says you can't fix a secret. So it's good hearing that feedback, and now we have things to work off of. So.
If you were to pick the top things that you think need to change with that program, what would they be?
Add the top opportunities, assertive engagement, and then coordinate.
What do you mean by that?
As far as relentlessly pursuing our neighbors that are in need. So there's a difference between, if you look at, I know you've been to East County, so Gresham specifically, we have homeless outreach workers that connect with folks every single day and then connect them to services. Same with 4D Recovery. They're out there every day connected, meeting with people, letting them know what their options are, and then guiding them to the resources. So just that. And then better coordination of services around across the board, and then using the pieces of technology, for example, to see where people are dropping off, because there's all these various perspectives or what have you. So those are the two main things, or the top three things that I would focus on: coordination, assertive engagement, and outreach. And I forgot the third thing that I mentioned.
So you're not really looking too much in terms of changes at the enforcement portion of it, the things that police and Vasquez have asked for?
Changes as far as
more accountability in terms of not letting people leave,
Yeah,
pressing charges if they, Multnomah County is one of the only ones that doesn't hold charges in advance, for example.
Yeah. One of the things that I've heard when I hear them say accountability is just outcomes. How are we tracking outcomes? Are they just coming to the care facility and then just leaving, and then they're going back to?
And most of them are.
And using publicly. And then how do we address that? And we need to explore those options, whether it's through treatment, and then so yes, we have to have that conversation because it's inhumane to just let people just exist and not relentlessly pursue and provide opportunities for folks on their pathway to recovery.
So just to be super clear, kind of sounds like you're saying I'd rather focus on the engagement aspect than focus on the arrest and prosecution.
We have to
aspect.
focus on the whole system at large. It's not a one-size-fits-all. And this is coming from someone that supported multiple family members on their recovery journey and have directly, as you know, reached out to Grizzly and others. Whenever there's someone out there, I always stop and I do my best to help engage, learn. We don't have a system of care that's working, and that's what we're developing currently. The whole board is committed to that, and so same with our public servants, law enforcement, and the DA, and the courts, even the public defenders. So it's incumbent on us to develop a system of care that works. We have to be tracking outcomes. We have to be clear as far as what are the expectations, and then we have to provide those opportunities to our neighbors that are struggling.
So when you list your priorities, though, the changes that police and district attorney are asking for are not in those priorities. Is that a secondary?
My priority is to develop a system of care that works for everyone. That is my top priority. And we have to do that together. So create space, that's one of the reasons why we hosted the conversation today, and we're going to continue to host conversations and track just the progress that we're making. We have to do that. So it's just like I can't say it's this versus this other thing, because it's extremely complex, and that's one of the things that we all need to know and understand and embrace. But we know that what we currently have isn't working.
So
or
you're
isn't
not
fixed.
willing to say whether you support, Grant Hartley's sort of proposal, which contradicts Vasquez's proposal.
They don't contradict. I don't believe that. Yeah. Again, we're developing the solution together.
Okay.
Yeah.
Are you guys developing this solution together?
Mm-hmm.
Or,
That's what we did today.
Okay.
Yes.
But the chair is not here yet, and that executive step is not there yet.
Her staff was here,
Okay.
and then she wasn't here today because she had a conflict.
Gotcha. So you are saying this is going to turn into a
Yes.
conversation that will prompt change in the program.
Yes.
Okay, gotcha, understood. Anything else you want to add that we didn't cover?
No. Just thank you for just, again, covering just the progress and just the great questions as well. Again, we're in the process of developing a system of care that works, and I think everyone has identified, as you heard the majority of the board mention today, we have to work together on developing it on this. We have to have real conversations, and also you can't fix a secret, so it's just, it's incumbent on us to do that, and we need to ensure that everyone's at the table, to include the DA, police department, service providers, the healthcare workers that were here today as well, and then the whole board. So we have to provide clear direction, and we have to work together as far as addressing the needs.
Gotcha.
So
Thank you so much. Appreciate
You're
it.
welcome. You're welcome. Thank you.
Do you want to say spell first and last?
Sure. Julia Brim-Edwards, Multnomah County Commissioner, Julia, last name Brim-Edwards.
Okay, great. And then, so where do we stand right now with Deflection, if you were to sum up what is going on in this moment?
Yeah, so recently we received the first year of data and the results from the Deflection Center. And from my perspective, we clearly need to change the trajectory and have a reset of the program. I think the outcomes that we got for the money we spent are not what we wanted. And also, most importantly, the individuals who visited and were sent to the Deflection Center didn't all receive the services and or get on a pathway to treatment and recovery, which is the whole point of deflecting somebody from jail, to get them into treatment and recovery.
What would you say is the biggest hole right now that needs to be addressed?
Well, I think it's the gap between what our expectations of what the Deflection Center services should be offering and what people are actually being offered, or the outcomes. So I believe the commission, when we made the investment, and the public believed that when we decided that people wouldn't be taken to jail and be charged, that instead they would get on a path to treatment and recovery. And that's not happening in the numbers that we expected originally. So from my perspective, we need to change the success criteria. We need to add some additional accountability. We need to make sure that the services that people need are there when they need them, whether that's needing to get into withdrawal management, getting into housing, providing them other support services so that they can get on a path to treatment.
The accountability measures and redefining success, that would require executive team to go through CJC approval. Is that correct?
I don't believe so. I believe that if you look at the statute, that we have the ability to define success, and other counties have. When I look at the standards of success from other counties have set the standard higher. And I think we need to do that to add some accountability into the system. This morning we heard from our law enforcement partners of it's discouraging for them when they have somebody who needs support and actually they're just walking in the front door and walking right out the back door, and then also not engaging in services. We can't have this revolving door or people just refusing to engage in services.
So you believe that by redefining success, that will stop that from happening? So say, hey, if you walk out right now instead of taking this assessment, then you will automatically fail deflection and could be arrested.
Well, I think there will be consequences, and it'll elevate the level of engagement they might have and the expectations for their further engagement. Because right now, they can essentially, with very little penalty, just walk in the front door and just walk right back out again. And I think what we need to have is a longer period of time, and also to ensure that we set the standard of what that they actually are engaging with some treatment services, knowing that some people may engage, they may fall back into addiction, but that they have taken the steps to try and get treatment, because we know that it's not necessarily a linear path, but that they are actually actively engaging with peer support services, with other treatment services. Those are absolutely things that I think if we set the expectation at the front end, people are much less likely to actually end up in sort of the next stage, which is a much more active stage with the justice system.
So are you ready to decide exactly the definition of success would be for you? And then once that is done, if you're able to decide on this as a commission and vote on it, wouldn't it still fall on the chair to make those recommendations and direct as an executive?
That's not in the statute. The leadership team is something that the county just set up. In fact, the county chair is not even in statute as a participant in those people who are actively engaged in setting up the deflection program. So
if you as a county pass an ordinance saying, hey, deflection leadership and administration, here's how we want to define success, here's what we're telling you to do, would that work?
I think the commission has the ability to define success, and we need to define success also informed by our partners in the health department. Certainly we need to do it in conjunction with law enforcement, with the district attorney, and it can't be in isolation. But I do believe the commission can redefine success. Commissions all across and counties all across the state have set much higher standards.
Yeah.
I think we absolutely have to do that.
My question is just purely technical.
Yes, I believe we have the ability to do that.
So if you passed an ordinance, Turk House would be required to implement the change?
An ordinance or a resolution, or just direction in the budget.
Yeah.
Certainly those are all things we can do.
Okay, gotcha. And then in terms of these charges coming up in January, that's a really quick time frame for that to start happening. What do you think needs to happen in the interim for you guys to prepare for that and make sure that your deflection guests or clients, or however we're calling them, are informed?
Yeah, I think the district attorney is doing what he feels is his responsibility for both public safety, but also to build some accountability from his standpoint into the system, and I'm supportive of that. From the county standpoint, we need to take a whole series of actions. I think, again, we need to redefine success. We need to make sure that the health department and our other partners, like 4D and the other peer support services, have the resources they need when people show up and are ready to receive services, that those services are available. And I think Commissioner Singleton has repeatedly made the point that in some cases it's not needing new resources, but better coordinating existing county resources. We know many of the people that come to the deflection center are homeless, and so coordinating with the homeless services department to get them into transitional housing or some sort of recovery housing or a shelter where they can be stabilized, those are all those are services we currently provide. So we should be standing them up and ensuring that those are available for people who are referred into the deflection center.
Okay.
And I think we can do it.
In terms of, these charges are happening in January. Right now, people being dropped off at the deflection center don't know that they will face charges. They're being put on a list, and that list will be handed over to the DA. Is this something that you will direct providers? Are you allowed to direct providers to just, hey, start letting people know?
Well, it's my understanding that the district attorney is working very closely with law enforcement partners, and that would be part of the process before somebody's taken to deflection. Obviously, if they're choosing deflection, they're being informed now. This is what our expectations are, and the citation that they'll be getting is just an additional step. It's not going to change what happens when they get to the deflection center, but hopefully it will change what their understanding of what's expected of them. Like, our expectation of it is you're not going to jail, but you're going to engage in deflection services. And I think the citation that's being issued is a way for the system to add some accountability to that individual of what our expectations are. Because this is first and foremost about the person getting the services they need. It's also about community livability and community safety. And often that's missing, because when somebody just goes in the door, refuses services, goes right back out again, my guess is that's going to have an impact on community safety. And so there's sort of a two-part reasoning of why we're taking these steps.
Wouldn't it be up to Turk House too, though, to kind of reinforce, hey, you're walking out that door, you're going to face charges. Likely, I wouldn't do that if I were it seems like as a provider, they should be directed to inform people
again,
that there's a consequence.
I think there will be close coordination between Turk House, law enforcement, the district attorney, our county staff who are at the deflection center as well, to inform people both of the services that are available and also the accountability that's being built into the system.
All right. Anything you want to add that we didn't cover?
Is there anything I missed? No, I'll just say, I think this is a really important reset, and it's going to require that we work hand in glove with the district attorney, our law enforcement partners, but also all the county service providers who we know are going to provide very critical services that are needed. But we can't have this revolving door, or people declining to engage in services and not having any consequences.
Thank you so much. Appreciate it.
Thank you.